All right. Thanks everybody for joining us today for our 4-Minute Friday. These segments, we take the opportunity to spotlight or highlight different kind of parts about the environment and things that residents and former grads really appreciate about being an Advocate Christ. Today we're going to talk and focus a little bit on critical care. And so I'm here with two of our now former grads, Jenny Stancati and Ethan Estoos, who are going to join us to talk a little bit about their critical care preparation at Christ and kind of what they most valued about their training. So I'll let you guys introduce yourselves first. Ethan, go ahead.
All right, so my name is Ethan. I'm originally from the West Coast. My wife and I came out here to the Midwest for medical school, and specifically the Chicago area. Stayed for residency, and then I just graduated from Christ this summer in 2020. And now I'm a critical care fellowship at OHSU in Portland, Oregon.
Hello, I'm Jenny Stancati. I grew up in Toledo, Ohio, and I graduated residency in 2018 from Christ. And I just finished my anesthesia critical care fellowship at Northwestern, and I'm joining the critical care staff back at Christ very soon.
And we're super pumped to have her back. So before we go on the clock with you guys, to keep us on track, we always try and do something fun that relates to the Chicagoland area. And so first thing I ask you guys is for your favorite pizza place. It can be in the city or the city, kind of city proper Chicagoland area if you're out in the burbs. Ethan, I'll let you pick first.
All right, so I've got a boring, non-native Chicagoan answer, but Giordano's deep dish, bacon barbecue chicken, it's really good. Recommend it.
I used to be a Giordano's fan. Now I am definitely Lou Malnati's with sausage. And occasionally I'll get a salad on the side that I never eat, but I like their salads too.
I'll pick as well. If I'm going deep dish, I think Pequod's is actually the best deep dish in Chicago. I grew up working at Armand's in Elmwood Park, and I think they've got the best thin crust. So there's a couple Armand's locations. Those are what I would pick. All right, now that we got the important stuff out of the way, we can talk about critical care medicine. I'm going to put us on our clock while we're timing here. All right. And so the first question I want to ask, and we'll start with you, Ethan, is your favorite part about training at Christ?
So I think one of the big things that drew me to Christ, and one of the things I'm going to miss the most about Christ, are the people here. And this is like a really cliche answer, but it's true. It definitely has been true, at least in my experience. I think the people here, including some of the mentors we're going to talk about a little bit later, and how they can sort of help shape your sort of journey in preparation for fellowship, is huge. And the experience at Christ in general as well. You get to see a lot of sick patients, do a lot of really cool things, and I think that can set you in the right mindset for critical care fellowship, give you the experience, and you go in, I think, and hopefully do well. We'll see. And definitely can spark an interest in critical care if you have that going in, like I did initially at residency.
How about you, Jenny? What was your favorite part about training at Christ?
Of course, I love the people too. One of the other things that I really thought was a highlight of Christ was the patience. The acuity there really is unmatched, and I saw that from day one until the last day of residency, and it really made learning fun and engaging and a hands-on experience, which for me was exactly what I wanted.
Awesome. Jenny, I'll stick with you here. Obviously Ethan's just getting started in his fellowship, but did you feel like you were well prepared for your fellowship?
Absolutely. There are multiple reasons why I think Christ prepared me for critical care fellowship. First, like we already said, there was always an abundance of patients in the emergency department with critical care needs, procedures, and anything that you could possibly need to prepare for a critical care fellowship. There are also elective rotations to help build upon the experiences in the ER, working in other ICUs that also have very sick patients and opportunities for learning. And then overall, just the critical care environment in relation to the ER at Christ, I think is really inspiring. Makes you want to learn how to be a better doctor, and the mentorship there is just unmatched. To have so many ER trained intensivists and people who really understand the process of going through ER to get through critical care, I definitely would not be where I am today without them.
Jenny, who would you say were your favorite mentors at Christ, critical care mentors?
That would have to be Dave Baronis and Samir Patel.
Okay. And I'll sort of pivot off of that, Ethan. I'll come back to you. Who would you say were your best mentors at Christ?
I mean, Dave and Smear for sure, hands down. But now we've got even over the past 2 years have accumulated a small army of intensivists at Christ, which is just fantastic, but interesting in critical care. But now I've got people like Ken Dodd, Nick Goodmanson, Leon Engelman, Emily Jonas, and a bunch of others. And now Jenny Dank as well is joining the ranks.
Ethan, you actually, Jenny had talked about some of the electives and different sort of ICUs that people can work at. Why don't you tell us a little bit just sort of about the ICUs that you rotated in? And then obviously you had sort of a unique experience with COVID at the end of your residency here.
Yeah, so as part of our standard residency curriculum, you definitely get experience across a variety of different ICUs, which like Jenny said is huge, just in terms of learning and exposure to different environments. A couple of those include things like the trauma ICU, our pediatric ICU, medical ICU, obviously. There's opportunities to do electives in other ICUs. And then as part of this recent sort of COVID pandemic, we created a fairly busy COVID ICU, which I had the opportunity to spend a couple months in near the end of residency, which was a fantastic learning experience and really just a unique opportunity overall. Glad it's coming sort of, at least for now, down to a close and ready to get back to the rest medicine, but it definitely was a great growing and sort of learning experience for me.
Ethan's too humble to say it, but he spent a couple months in that COVID ICU at the end of residency here. At one point, I think actually got his own PAPR to walk around in, but it was incredibly busy. The most recent numbers, I think we're well over 1,000 patients admitted and treated. And at some point, we had like 22 patients on ECMO at Christ. And so we talk a lot about that unique patient population and how sick they are. Really offered a unique experience, I think, during this pandemic as well. We're coming close to our time limit, and so I'll let you guys finish really quickly with, I want just a kind of one-liner on what you think was the ACMC difference, the thing that you missed the most about Christ, or that little thing that kind of made the experience for you. Jenny, we'll start with you.
For me, definitely, it was the Nona's pizza that Steve Nannini provided every time you worked a night shift, and sometimes in the morning too, at like 6 a.m. when you walk in, you eat some of that stale pizza. That made the difference.
And Ethan, how about you?
I'm gonna have to go with the charting rooms. I think they're just a really special part about working at Christ, and the part of working at Christ that I'm gonna miss the most. I wish I could sort of pick them up and take them with me to wherever I'm gonna go. But just the opportunity to just like sit there with some good friends, work through some hard stuff on a shift, but also just be able to build some awesome relationships, tell some good stories. It's almost like you're just going to work and hanging out with your friends during a busy shift every time you go to work, and it's fantastic.
Well, awesome, guys. I appreciate your time, and good luck, Ethan, as you're starting out in Oregon. And Jenny, we can't wait to see you back at Christ, and soon I get to start calling you all the time to admit patients.